Welcome to the SmartKeys podcast. I mean, what if the biggest existential threat to a massive, multi-billion-dollar hospital network wasn't a global pandemic or a new superbug, but just a legacy software update?
Yeah, that is a terrifying thought, right?
It really is. And, well, we are thrilled to have you joining us today. If you are a modern professional, whether you're an executive or an investor or just someone trying to understand how technology is completely rewiring the business landscape, just consider this deep dive your essential briefing.
Exactly, because we're opening up a really massive, incredibly strategic playbook today.
Right. We're looking at a comprehensive piece by Felix Römer, and that's published over on smartkeys.org. It's titled HealthTech Trends: Business Opportunities in Digital Health. And, we aren't just going to list off statistics here.
Yeah, definitely.
We are treating this as your roadmap for understanding how software, artificial intelligence, and new workforce dynamics are actively reshaping the future of work and business efficiency.
And to understand why this matters to you right now, you really have to look at the massive stress test the healthcare industry is currently undergoing. I mean, we are talking about a sector that touches literally everyone, yet it is fundamentally a business ecosystem under siege.
Yeah, under siege is a good way to put it.
Right. The organizations that figure out how to leverage new software, deeply integrate AI, and redesign their workforce management to survive the shift, well, those are the organizations that will dictate the business winners of the next decade.
It's definitely not just about surviving a tough quarter anymore.
Exactly. It's about capturing entirely new value pools that are forming right in front of us.
Okay, let's unpack this, because we really cannot talk about the flashy software solutions without first understanding the systemic fractures that forced the industry to evolve in the first place.
Oh, absolutely. The macro forces are just impossible to ignore right now.
Right, you look at the market over the last year or so, and you see a cascading series of macro shocks. We had major, crippling cyber attacks that took entire billing networks offline for weeks.
Weeks at a time, yeah. It was chaotic.
And then climate-driven disruptions, like extreme weather knocking out regional grids. And then you layer on the intense policy volatility, specifically with CMS, drastically tightening their reimbursement rates.
It was basically a perfect storm of vulnerability. When extreme weather knocks out power, you suddenly realize that remote patient monitoring isn't just a nice-to-have convenience, right? It is critical infrastructure.
Definitely. It's life or death.
But perhaps the most immediate financial shock we are seeing is the rising medical cost trend. And that's primarily driven by the massive, unprecedented uptake in GLP-1 specialty drugs. PwC actually flagged this as the biggest medical cost inflation in a decade.
Let's actually pause and explain why that specific drug class is causing such a financial earthquake. Because, I mean, we aren't talking about a generic antibiotic you take for 10 days.
Exactly. GLP-1s are chronic, highly expensive specialty medications that patients take indefinitely. And their adoption curve was practically vertical.
Yeah, it just skyrocketed out of nowhere.
Right. And payer organizations price their insurance premiums based on historical actuarial data. Suddenly, you have millions of patients jumping onto prescriptions that cost, $1,000 a month with no end date.
Which completely breaks the model.
It fundamentally broke the actuarial models, yes. It shifted the entire risk pool for payers overnight.
The downstream effects of that are just staggering. Because of this massive inflation, 7 out of 10 consumers now report having trouble affording their rising healthcare bills.
7 out of 10, that is a massive portion of the population.
Right. And the financial markets reacted immediately to this turbulence. We saw a very specific investor signal. Medicare-aligned stocks outperformed while Medicaid-centric firms weakened significantly.
If we connect this to the bigger picture, you have to look at the mechanics of why those stocks move.
Okay, how so?
Well, Medicaid-centric business models operate on razor-thin margins, and they rely heavily on high volume. Their patient populations often have complex social determinants of health, meaning higher overall utilization of services.
Oh, I see. So when CMS tightens reimbursements in an environment where drug costs are skyrocketing, those margins just vanish.
Exactly. Those razor-thin margins evaporate. Those macro forces are fundamentally squeezing payer margins across the board. The industry can no longer afford to just patch old systems.
Yeah, duct tape isn't holding anymore.
It really isn't. This margin squeeze is the absolute catalyst driving an urgent transition to a proactive, platform-level overhaul.
It makes me think of an analogy. Watching the market absorb these shocks, it's like The entire healthcare system went through a massive, unannounced corporate penetration test.
Mm.
And frankly, the system failed.
That is the perfect way to frame it.
Right. These macro shocks didn't just cause a few days of temporary downtime. They exposed the deep structural tech debt of the entire industry.
Right, when clinical systems go dark because of a single cyber attack on a third-party vendor, it reveals that the underlying infrastructure is incredibly fragile.
Very fragile. Yeah.
Because the existing infrastructure failed that stress test, the immediate strategic move for business leaders right now is modernizing their core data foundation. You simply cannot layer advanced predictive analytics on top of a broken database.
Which brings us right into the core of how businesses are rebuilding. Right now, 60% of executives are actively targeting massive upgrades to their EMR and ERP systems.
They are essentially ripping out the old plumbing.
Which sounds terrifying. It's like trying to change the engine of a commercial airplane while it's currently flying over the Atlantic, and all the passengers are actively sick.
It's a daunting task for sure.
But they have to do it. Because concurrently, 77% of health executives are placing artificial intelligence among their top 3 priorities.
But there is a massive distinction happening here in the market. They aren't just running small, isolated AI experiments anymore.
Right. The focus has shifted entirely to agentic AI.
And we really need to unpack how agentic AI differs from what people traditionally think of. Traditional analytical AI might look at a patient's chart and flag a high risk of readmission. It analyzes and alerts.
Okay, so it just points out a problem.
Exactly. Agentic AI, however, acts. It orchestrates multi-step administrative workflows.
Give me a tangible example of what that looks like on the ground.
Let's take prior authorizations, which is one of the biggest administrative bottlenecks in medicine.
Oh, for sure.
Traditional AI tells a nurse, hey, this procedure requires an authorization. Agentic AI actually logs into the insurance portal, pulls the specific clinical notes from the patient's history, drafts the justification letter, and hits submit.
Wow, so it actually does the paperwork.
Yes, it acts as an agent on behalf of the user. It mimics the human clicks so that the clinical staff can focus purely on actual care.
Here's where it gets really interesting, because as a professional looking at this, I have to play devil's advocate and challenge the hype. Are we just throwing trendy algorithms at a burning building? I mean, let's be realistic here. If an agentic AI is processing 10,000 complex insurance claims an hour, a human being is not checking every single one of those.
No, they definitely aren't.
So how does this technology actually fix a broken billing system without just hallucinating a bunch of incorrect medical codes at scale and creating a massive liability nightmare?
That is exactly the right concern, and it's why the smartest organizations are absolutely obsessed right now with responsible AI.
Okay, what does that entail?
Well, you can't just plug a trendy large language model into a hospital's network and let it run wild. To prevent that exact liability disaster, you need an ironclad data foundation.
Meaning clean data.
Yes, that means completing cloud migrations, enforcing strict data lineage so you know exactly where every data point came from, and building single-source information repositories.
Because if the data is messy, the AI just automates the mess faster.
Precisely. And beyond pristine data, there is a massive regulatory and governance layer acting as a liability shield.
Like what kind of regulations?
Deploying AI in this space requires strict compliance with frameworks like the EU AI Act and the latest FDA updates on AI-enabled medical devices. You have to assess your training data for systemic bias and set up hard monitoring rules.
And I imagine you need some human oversight too, right?
Critically, yes. You have to mandate human-in-the-loop controls.
But wait, if the human is in the loop, doesn't that defeat the speed of the automation?
Not if designed correctly. The AI does 95% of the heavy lifting. It gathers documents, writes summaries, cross-references codes.
I see. So it preps everything.
Exactly. The human is the final arbiter, reviewing the package decision and hitting approve. The technology acts as a hyper-efficient orchestrator, but the human remains the safeguard to protect care quality.
And focusing on that human user is absolutely critical right now, because having pristine data and brilliant AI creates a new, incredibly dangerous bottleneck.
What do you mean by that?
Well, if the human nurse at the end of the line doesn't trust the AI's recommendation, or if they are simply too burned out to even log into the system, that multi-million-dollar tech upgrade completely fails.
Oh, absolutely. The staffing pressure in healthcare isn't a distant warning anymore. It is fundamentally altering business models today.
Right. Let's look at what this transformation is actually doing to the workforce and the patient experience.
This is where the technology provides a very tangible, measurable return on investment. Look at recent workforce data. A Deloitte study showed that proper technology implementation can free up between 13 and 21% of a nurse's time.
We need to ground that statistic in reality because percentages can feel a bit abstract.
Fair point.
Reclaiming up to 21% of a nurse's time translates to roughly 240 to 400 hours saved per nurse every single year.
Which is incredible when you think about it.
400 hours isn't just a minor productivity metric. That is 10 full work weeks. Imagine telling an exhausted ICU nurse that you are giving them 2.5 extra months of time back every year.
Just by fixing the software workflow so they don't have to fight with drop-down menus all day?
Exactly. That is not an IT upgrade. That is a survival-level retention strategy.
It is entirely transformative for workforce productivity, but, that potential has to be paired with real workflow redesign.
Right. You can't just fill that freed up time with more admin work.
Exactly. You have to actively cut the low-value administrative work so that the reclaimed time translates into actual relief. And then you have to look at the flip side of the workforce, which is the consumer.
Oh, yes. The consumerization of care.
Right. Patients now expect their healthcare interactions to feel exactly like a retail app. Fast, intuitive, with clear pricing.
One of the biggest indicators of this is the 30% growth in ICHRA arrangements.
Yes, the individual coverage health reimbursement arrangement. We really need to explain how ICHRA fundamentally shifts the market dynamics.
Let's do it.
Traditionally, your employer picks a health plan and you are stuck with it. With ICHRA, the employer gives the employee a tax-free financial allowance.
Okay.
And the employee takes that money and buys their own insurance on the open market. It shifts the burden, but also the choice, directly to the consumer.
It forces the patient to act like a retail shopper. And to capture those retail-minded shoppers, organizations are scrambling to build an omni-channel digital front door.
They want to integrate SMS, chatbots, web portals, and telemedicine, all based on how the patient prefers to communicate.
It's like a modern SaaS onboarding experience. You want every single point of friction removed so the user doesn't bounce to a competitor.
That is the business goal, certainly, but there is a very stark warning coming from clinical bodies, including the American Medical Association.
Yeah, they're warning against a one-size-fits-all approach to this consumerization.
Exactly. This is what we call the equity paradox. Telemedicine might be absolutely excellent for keeping a low-income single parent from having to miss a day of work for a routine prescription refill.
It removes a massive barrier to access.
But treating a complex medical crisis exactly like a frictionless e-commerce transaction carries massive clinical risk.
Because you lose the physical context.
Yes. If you design your business to push every patient interaction to a digital screen just to lower your overhead, you risk missing vital clinical signals that a physician would only catch during a hands-on physical exam.
Like a subtle tremor or a change in skin tone.
Exactly. Furthermore, if you blindly digitize everything, you risk creating new care deserts for vulnerable populations who lack broadband internet or digital literacy.
So true operational efficiency here isn't just about maximizing automation at all costs. It's about upskilling your staff so they understand how the AI works and actually trust it.
And designing rigorous clinical protocols that know exactly when to route a patient away from a convenient chatbot and force them to come in for an essential in-person exam. You have to ensure that retail convenience never overrides clinical quality.
So what does this all mean? Where does a modern professional look to ensure they are staying ahead of the competition? Where's the capital actually flowing?
This raises an important question about capturing financial value. The capital is flowing toward entirely new value pools, fundamentally shifting away from legacy hospital models.
Right, and a critical mental model for this is PwC's 4Ps framework.
All right. Yes. Prevention, personalization, prediction, and point of care. This framework maps the monumental shift from reactive business models to proactive ones.
Let's break down the mechanics of those 4Ps. Prevention uses data integration to spot rising health risks before they become emergencies.
And personalization uses behavioral data to tailor outreach so patients actually adhere to their medications.
Right. Prediction leverages that agentic AI to trigger early interventions, keeping people out of the ER. And point of care is bringing medical services out of massive hospital campuses and directly into retail clinics and living rooms.
And speaking of living rooms, there is a massive demographic and funding surge driving the home health sector. We are looking at projected employment growth of 21% for home health and personal care aides by 2033.
21% growth is a glaring market signal. Why the sudden explosion?
It is driven by an aging demographic that prefers to age in place, combined with the fact that treating a patient in their home with remote monitoring devices is exponentially cheaper than keeping them in a hospital bed.
We are seeing virtual nursing kits that flow real-time biometric data straight from a patient's living room back to a central care team.
All of these shifts, the AI, the cloud platforms, the remote monitoring, they constitute a massive $1 trillion ecosystem transfer.
Meaning the market value is physically transferring away from traditional care facilities and moving heavily toward cloud vendors, specialized AI startups, and platform solution providers.
Exactly. If you are an executive today, you realize you cannot build all of this in-house. You have to prioritize strategic partnerships with major hyperscalers to lower your execution risk.
But expanding your digital ecosystem across thousands of vendors and patient homes opens up a terrifying new frontier of cyber risk.
Yes, and this is where we see a dangerous disconnect. Cybersecurity is no longer just the IT department's problem, it is a fundamental business enabler.
Current data shows that 78% of executives plan to boost their cybersecurity budgets next year.
Yet, astonishingly, only about 15% of executives say they meaningfully measure their financial cyber risk.
They're throwing money at firewalls, but they don't actually know their exposure. If everyone is buying the latest AI and upgrading their cloud systems, how do you measure real resilience?
Well, you cannot just buy a massive cyber insurance policy and assume your business is safe. True resilience means tracking highly specific operational KPIs.
Like what?
You have to track your MTTD, mean time to detect an anomaly, and your MTTR, mean time to respond.
So it isn't just about software, it's about operational readiness.
Do you actively run downtime playbooks and tabletop exercises with your clinical leaders? If a ransomware attack takes your EMR dark, does the ICU know how to switch to paper charting in 3 minutes, or does the entire hospital freeze for 4 hours?
And you have to apply that exact same rigorous, metric-driven approach to the innovation side. You don't just buy a flashy AI platform so you can put it in a press release.
No, definitely not.
You have to map that technology directly to operational metrics. You tie the AI's performance to shared savings contracts and specific clinical KPIs, like improving chronic disease control.
Exactly. You have to prove to your investors and stakeholders that your tech investments are actually bending the cost curve down.
Which transitions perfectly into the practical playbook for immediate action.
Yeah.
If you're a professional listening to this, how do you take these massive macro trends and apply them this quarter?
The most successful organizations are highly focused on their go-to-market strategies.
And the key to that strategy is hypersegmentation. You cannot pitch the same value proposition to everyone in this complex ecosystem.
Think about who you are selling to. If you are selling a solution to employers, their primary concerns are cost control, clear pricing transparency, and improving their employees' health benefits experience.
Right. And if you are targeting payers, the insurance companies, their entire focus is on controlling patient utilization and gaining massive administrative efficiency.
And if you're dealing with providers, the hospitals and clinics themselves, they are desperate for margin lift and increased patient throughput without adding more administrative friction.
To win those complex procurement cycles, you have to validate your return on investment with undeniable real-world evidence, and you have to do it fast.
The standard playbook right now relies on short, highly measurable pilots with crystal clear success criteria.
You don't pitch a 5-year transformation. You measure the time to implement and the exact workflow impact, ideally validating that ROI within a single fiscal quarter.
Because in this market, speed to value is everything. And to ensure that speed, you have to arm your sales and strategy teams with the right ammunition.
They need robust economic models that prove financial viability. They need hard clinical evidence proving patient outcomes improve.
And critically, they need rigorous security information packets ready to deploy on day one.
Because if you want to turn a small one-off pilot into a scalable enterprise contract, you have to be able to pass a hospital's grueling due diligence and IT compliance checks instantly.
Ultimately, the leaders who will capture the biggest opportunities in this massive $1 trillion shift are the ones who focus relentlessly on measurable operational wins.
It is an incredibly detailed roadmap for turning market volatility and systemic stress into actual operational momentum. But as we wrap up this deep dive into Felix Römer's insights, I want to leave you with a lingering thought.
Okay, let's hear it.
We spent this entire time talking extensively about the incredible, almost magical power of this technology. We are talking about automating massive administrative workflows, shifting risk pools, and reclaiming 400 hours of a nurse's year. But If predictive agentic AI flawlessly handles all the complex triage, and if algorithms govern the scheduling and the outreach, what happens to the fundamentally human art of care?
That is a very profound question.
As we aggressively optimize our systems for maximum business efficiency and retail-like consumer convenience, how do we as leaders ensure that the deeply human element of healthcare, the empathy, the intuition, the physical connection, isn't accidentally optimized entirely out of existence?
That is the defining tension of this entire next era. It's not just about building smarter, faster systems, it's about making absolutely sure those systems serve the human being standing on both sides of the screen.
A perfect place to leave it for today. We want to explicitly thank you for tuning in to the SmartKeys podcast. If you found this strategic breakdown valuable and it helps clarify the market for you, please make sure to subscribe to the podcast so you never miss a deep dive.
And we strongly encourage you to read the full, in-depth article by Felix Römer over at smartkeys.org to explore these frameworks and insights in even greater detail.
You can find the direct link to the article right in our show notes. Until next time, keep looking forward.